Minister, much of that new funding was obviously allocated very suddenly and unexpectedly a number of weeks ago now. So can you now tell us, several weeks later, specifically how the COVID-19 expenditure pressures have altered the government's overall future spending priorities and savings priorities in the health portfolio for the remainder of the 2.5 years of this term of Parliament?
Minister.
Thank you, and I thank the member for her question. The member is correct in that the government has made an unprecedented investment to the coronavirus response, nearly $2 billion of funding to do a number of things to bolster our public health team. Firstly, we've gone from 37 to more than 1,000 disease detectives doing that contact tracing on a daily basis, and this team is working 24 hours a day, 7 days a week on this important work. I take this opportunity to thank them for their dedication. The investment has also gone to our hospital preparedness. And regardless of how we're tracking, it's important that our hospitals are well prepared, and I thank them also, all of our health services right across Victoria who have done amazing work to prepare. This has gone towards staff training. I mentioned just before in my own minister's statement, the 15,000 volunteers from our healthcare professionals have put their hand up in our time of need to be able to step up if we need them. So it's gone to staff training, it's gone to purchasing the personal protective equipment to keep our healthcare workers safe. We've had millions of items come into our warehouse. We have established a centralised procurement process to make sure we can distribute masks and gloves and gowns and all the other important items out to our health services on a daily basis. It's gone to purchasing medical equipment to establish more intensive care unit beds across our hospitals and also bolster our bed capacity. So we have created additional beds at a number of hospitals, the old Peter Mac Hospital down the road from here, Baxter House in Geelong, Bendigo Hospital. So many of our health services have actually got additional bed capacity in relation to our response. Given the time I have available to me, I would say to the member that we have been tracking well. Yes, we have had some larger numbers in recent days, and that is because we have been easing up restrictions, particularly since the start of this month, and we did flag at the time that that would mean that as the community was moving out and about more, the risk would be of more community transmission. We will have more new cases and more outbreaks, but this is why we've bolstered our public health team's capacity to deal with outbreaks as well as dedicated rapid response squads so we can manage these issues. We have started to move into a phase of resuming many of our health services' normal operations, including elective surgery. I'll have more to say about this as time goes on. But we are making sure that Victorians get access to world-class healthcare services, no matter what their issues, whether it's a coronavirus issue or non-COVID related.
Sorry. Ms Maxwell, supplementary.
Thank you, President. Thank you, Minister. And I'm glad to hear you mention the care and consideration for hospitals and staff. Following all the COVID-related expenditure, can you please clarify for me what the outlook is for future funding for rural and regional hospitals and health services? That is, what will the changed post-coronavirus environment mean specifically for in-need facilities such as the Swan Hill Hospital in my electorate? That site desperately requires new funding, but such a prospect now seems even more clouded given that billions of dollars have been directed to COVID-19 related measures instead in the meantime. It's obviously, I'd obviously be grateful if the Minister could touch in her answer on what the changed environment may also mean for already announced funding, like for the upgrades at Wangaratta Hospital, Goulburn Valley Health and Albury Wodonga Health.
Minister.
Thank you. I have very limited time to address a lot of issues there. Firstly, can I take the opportunity to thank the health services that the member has mentioned. You know, we have had great work done by our regional health services to support their communities in what has been a very challenging time. And we have been working with those regional health services to make sure that we can also ensure additional ICU bed capacity in regional communities, as well as bolstering the adult retrieval service, which transports patients from regional communities to metro hospitals if that's necessary as part of our coronavirus response. Obviously, the infrastructure needs of all of our health services will be considered through future budget processes. Yes, we have put a significant investment to deal with the pandemic. We have prioritised the healthcare of Victorians, but we have a very proud track record of investing nearly $7 billion in infrastructure since we've been in office. It's the biggest ever hospital building program in Victoria's history.
Maybe you could...
More information to the member around some of the issues she's raised.